Dr. Kapoor, some foods are killing us. What are they?
If we're looking at one big food group, it would be carbohydrates and the sugar group. The reality is that this is fast energy. Now, if you're going to do a 20-kilometer run, the body would need quick energy, and we can see the rationale for carbohydrate stroke sugar. But we're not doing 20-kilometer runs, and predominantly these sort of are present in the majority of our diet habits, breakfast, lunch, and dinner. It's the bit that's added onto everything, and we've seen it as normal because we've grown up with it. In the 80s, there was a strong move towards cutting fat, so it was replaced by the carb. And it's not just in the Western world, it's everywhere. But carb itself is an energy form that is quite quick for the body. Unfortunately, it's also the trigger for inflammation. So when you go into fight or flight, you're there to run away from saber-tooth tigers or find food, water, shelter, the cortisol levels go up and it finds the sugar, brings it into the body so you can do what you need to do. In modern day, of course, we don't have to run anywhere, but that same response occurs. And so if you have a lot of this in the system, it'll create an inflammatory response. So carb equals inflammation. And in fact, when you talk about heart disease or dementia or joint problems or skin problems, it doesn't matter what it is. If you have the fuel to inflammation, you're going to get more inflamed.
And are some carbs worse than others?
Yes, I would say that when we look at refined sugars, of course, and ultra-refined processed foods and things like that, they're far worse. But overall, we do need them. We are still functional and active. But the question is, we don't need as much as we're taking. The other thing we have to remember is when we get used to eating in a certain way, the body requires it. The insulin responses go up and you think you're dependent on it. And when you don't take it, you feel unwell. And you think, that must be because I need it. The point is, the body has got used to that habitual level and it can easily change back again. So carb is not good, whether it's diabetes, it causes metabolic resistance. And that's not just diabetes. It's heart disease. It's in women polycystic ovary syndrome. It's dermatitis. It's psoriasis. It's rheumatoid arthritis. All of these things are inflamed by carbohydrate. Less carb in the system, less opportunity to become inflamed. So you're not taking the world's problems away, but the ammunition isn't there.
Yeah, okay. I found, I don't know, 15 years ago or so, I was obviously not happy with certain foods. I went to see actually several different consultants. They all tried different things. Absolutely nothing worked. In the end, I took things, I took control myself, and I cut out wheat, gluten, and dairy. And it made a big difference, pretty much actually overnight. And the symptoms I was facing, a bit of tiredness, a bit of lethargy, and a bit of stiffness and aching joints and so on. A lot of that disappeared. I then found, as I got older, that I realized I was less able to process carbohydrates, and that itself gave me inflammation. In controlling that, I control the inflammation as well. Does that all sound credible?
Absolutely, yes. I mean, our requirements of our body change as we grow up. Things like dairy are probably very important early in life. The body knows what it needs at certain points in time. And as it progresses, there are certain things that are not there and other things that are more relevant. So we need to listen to our bodies. And no one's saying stop everything, but moderate it and listen to your body. If you're reacting to gluten, it could be that your gut's inflamed and therefore can't tolerate it. So often gut inflammation, the body protests through certain foods. When you get the inflammation away, you can take more of it. We found that too. But we're not listening to our bodies, and we're eating traditionally in convention and not intuitively in terms of what our needs are. So I would say, bearing in mind that everything's about inflammation, we should avoid foods that are highly inflammable. So carb being one of them.
How good are we internationally at investigating, understanding, and starting to tackle or increasing the awareness of these sort of things through research, through studies, and so on?
So the answer to that is very good. The research is out there. The evidence is there. What we're not so good is putting it into practice. So our scientific colleagues have done research showing the link between a carbohydrate diet and inflammation. They've even done specific studies looking at carbohydrate diets and heart disease, carbohydrate diets and insulin resistance problems, carbohydrate diets and Alzheimer's. So all of these studies are there, but they're sitting in isolation. I think that the main thing here is how we can change that narrative and put it into clinical practice. So the scientific evidence between the link of inflammation and how we eat is very much there. And most people know that when you exclude this, they feel better. They just don't feel better in one way. Their bloods just don't look better. They feel good. So if carbohydrate or inflammation is causing diabetes, it's almost certainly causing inflammation elsewhere in your body, be it your joints, your skin, your brain. So the removal element gets you better, but it's also documented in scientific research.
Okay, that's good. We might put some of that in the notes. In terms of dementia then, what is the link and what chemically actually happens in the brain or to the cells in the brain that then causes the symptoms of dementia?
So dementia is a term where the brain is not working properly, and there'll be issues with memory, recall, and then later further deterioration. The two main elements of dementia are what they call multi-infarct dementia, which is vascular dementia. Oxygen is the elixir of life. Nutrients come through blood. If your vessels start getting smaller or narrower, or you're not being able to get the blood in the right place, the end organ will suffer. Right. That's what we call multi-infarct dementia or vascular dementia. Okay. And the risk factors for that are the same as they are for heart disease. So by definition, it's the same thing going on in the blood vessels in the brain versus the heart. And we now know that this is now an inflammatory process.
Okay.
So if you can mitigate inflammation, then you're not only going to reduce your risks of multi-infarct dementia, you're going to reduce your risks of almost all the other inflammatory conditions.
And can you improve? So if you've got it or signs of it, and it's vascular, can you improve it by changing things in your life?
Totally, because the body can regenerate. So if the insult is not continuous, those vessels will have a chance to recuperate themselves, which is why lifestyle is super important when people have issues with memory. The second group is where the cells have become lazy or stagnant. We're talking about cells generating at a very fast rate. But if those cells cannot function properly but are not quite dying, what we call senescent cells or zombie cells, they excrete certain proteins, beta amyloid plaque being one of them, that slow the brain down. Now, that's what we call Alzheimer's disease. And you can do PET scans to look for this amyloid plaque.
Okay. So it affects the other cells effectively.
It does, yes. So these cells are not dead, but they're not working. And then the cells around them start becoming zombie cells.
And they sort of clog up the other cells.
They clog them up, they become dysfunctional. And bearing in mind, that's where your recall, memory, functionality occurs, depending on which part of the brain's affected.
Right.
It'll impact in things like Alzheimer's disease. Now, again, going back, why would your cells get senescent? Your cells will get senescent if they're not fed properly or they're not protected properly, or there's chronic inflammation going on. And again, it goes back to the same principles once again. Feed the cell, protect the cell.
Right.
And so dementia itself is a progressive illness, but you can mitigate against it by taking these measures if you have it, or prevent it by taking these measures early, because those changes occur decades before.
Yeah, sure.
But they're silent.
So you can prevent it. You could arrest it. Can you reverse it? So, I mean, can you start to feel a bit better by the sort of changes you've described?
So for me, in those environments, it's very tricky because we see it's a big problem in social care, dementia. But also, if you look at the blood parameters of these individuals, they are quite depleted. Their vitamin D levels are very low. Their ferritins are very low. Their micronutrition is poor. So what we do is look at the output and try and manage the dementia, but we don't reverse right back and saying, let's get rid of the glycogen in the system, the inflammatory markers. Let's get the gut fixed. It takes a much more of an effort in this age group because you're dealing with challenge. But the point is, once you start doing this, the body has a chance of regenerating.
Yeah.
And we know with the brain that if one bit's not working properly, sometimes you can compensate with another working better. But we don't put enough emphasis on that. And more importantly, these individuals get stagnant. Their immune systems get slower because they're not as mobile. They're looked after.
One thing leads to another.
And totally. So you get this escalation. Now the question is that escalation because of the Alzheimer's or the fact that the rest of the immune system is failing?
And so there are a lot of things the patient has to absorb and be able to respond to, a lot of help to change all the other factors that will go to make this particular issue a bit better.
Well, we know now there's the new drugs coming out for dementia, but speaking to the geriatricians who've done the research, they said we can try and remove the beta amyloid plaque by giving you these drugs. But unless you deal with the lifestyle issues, we'll be back to square one.
Okay, yes.
So from my point of view, the point is, why aren't we dealing with them anyway?
Yeah.
Because that's the point. Now, intervention has to be quite intense. There's got a lot of motivation that's needed, but I'm of the belief that the whole system starts deregulating.
Yeah. Well, if we cut the costs, the massive costs from the health and care system in the way we discussed before, because a lot of the conventional treatments, which are only going for the highest level symptoms, is therefore wasted if we can get to the root causes of things. That will release massive capacity in the health system to focus on the sort of things you've just described.
And there's research. Because of the progress in medicine, we can fast track improvements. So an example is there are centers in the US now that use something called NAD. Now, NAD, nicotinamide adenosine dinucleotide, it's a long name, is a precursor to releasing the only energy that matters, ATP. Your mitochondria, your little batteries in your 30 trillion cells, release ATP energy. And that is the energy that allows your cells to breathe. As you get older, your ATP production line goes down. NAD can stimulate it. So there's centers in America where you can go in with dementia or Alzheimer's, and you can be given these regular NAD drips. So it improves the mitochondrial function. The brain, as well as everything else, it has the energy to regenerate, and the outcomes are looking very positive.
And if somebody starts that process and starts to feel better, the brain maybe feels a bit more alert, they feel a bit more motivated, they got more energy to think and do things. They will then be much more susceptible to the whole range of other lifestyle things.
And the problem we have is once you get labeled dementia, you stop looking for other things. We know how we feel when we're low in our mood. We don't think clearly, we're stagnant. Yeah. When you've got dementia, you're going to have problems with your motivation. The other big player is vitamin D. There's a lot of research showing the benefit of vitamin D in dementia. And yet most of us are suboptimal, partly because the ranges are not quite in the right range that they should be for human optimization. But again, what are these things? These are things that have gained from good nutrition, from lack of toxicity, going back. It goes back to the same thing. So by giving high levels of these things, we can see changes.
So would it be too extreme to say, if we can do all the things you've just described and get people early on to consider their lifestyle, we can eradicate dementia?
Everything happens everywhere at the same time. If you've got inflammation in your liver, you can bet your bottom dollar it's happening in your brain. Now, so for me, that early signal can mitigate dementia if you do something about that. But we're not good at recognizing these signals early enough. We sort of patch it up and move on. And each decade, it starts deteriorating until it flatlines, and it doesn't have to happen. We've got people in their 90s with super cognitive function, still running businesses. You know, there are leaders of industry in their 70s and 80s, still functional. Now, why can't everyone be like that? The reality is that everything happens everywhere at the same time. And if we can fix those root causes intensely through education and intervention, we can mitigate a lot of these problems from occurring.
We can't maybe eradicate all of it, but from a dementia point of view, if we do these things, we could eradicate a lot, maybe the biggest percentage of dementia.
Yes,
which is one of the curses in our modern society.
Yes, and if you look at your average dementia, there'll be osteoarthritis, there'll be fatty liver disease, there'll be ischemic heart disease, there'll be blood pressure. These are all coming from the same pot. So when you've got chronic inflammation, it accumulates. And by definition, then everything gets worse, which is why you see decompensation so quickly in the elderly.
Yes.
When something goes wrong, the whole
seems to, that's right. Yeah, the end seems to then come quite quickly.
Yes. And that's because the modalities are the same, and there's the insult just escalates everywhere.
Yeah.
And the bandwidth to the resilience is down. So through high-dose vitamin D, through looking at things like melatonin, a lot of research on melatonin and sleep hormone, through looking at cutting the carb out of the system, getting rid of the inflammatory glycogen, and looking at things not in a silo way, but in an integrated way, and listening to these signals early.